For In Your Corner's Katie LaGrone reveals how some are serving years on the state's watch list, yet still getting paid extra to care for COVID patients.
For Devon Irion, the moment came naturally.
I have no idea why I just put my hand in heart and just yelled, "Dad, I love you."
It was Father's Day, the last time she would see her 90-year-old father in person. COVID.
They sent him out to the hospital, and ultimately the next morning I found out from the nurse at the ER that he had tested positive for COVID.
At the time, Irion says she didn't know the nursing home her father lived in for nearly 5 years was housing COVID patients in a separate unit. In July, it officially became one of the state's 23 dedicated COVID isolation centers, or facilities contracted by the state to house COVID-positive seniors to help halt the spread of the virus in long-term care settings, according to the state. But unlike that facility, we've discovered many others on the list have histories plagued with deficiencies. 7 of them, or 30%, placed on the state's watch list.
When you're on the watch list, it means that you have performed unsatisfactorily when the state has come in to do their periodic reviews that they're required to do.
Sean Dominic is a Palm Beach Gardens-based attorney specializing in nursing home negligence.
It's not that we're talking about facilities that had deficits that were noted 10 years ago and they've corrected all of those. It's facilities that continue to have deficits in the past few months and deficits in areas that are directly impacted by COVID.
Take Countryside Rehab and Healthcare Center on Florida's West Coast. Its history of deficiencies go back more than a decade. Medicare's overall score below average. And in 2018, it hit the state's watch list for lacking an emergency plan. This year, the 120-bed center was again cited by the state. According to state inspectors, in June, it failed to mitigate the spread of COVID-19 by not implementing its disease prevention plan. Its staff seen not wearing personal protective equipment. A month later, it signed on to care for COVID patients and get paid extra doing it. In contracts we obtained through a public records request, these facilities serving as state isolation centers can get reimbursed more than double their daily Medicaid provider rate. Empty beds, no exception.
We're paying facilities that provide historically substandard care, and we're coming to them and saying, we're going to give you more money.
None of the 7 facilities with histories on the state's watch list responded to our request for comment. Florida's Agency for Healthcare Administration, which chose these facilities, told us in this email all facilities were vetted, receive enhanced oversight, and were in full compliance with state and federal nursing home regulations when designated. U.S. Senator Marco Rubio.
As far as to why the specific ones are chosen, I just don't know, because that's a decision that's made at the state level by the Agency for Healthcare Administration and not the federal government.
No, that's very concerning.
Devon Irion still questions why she didn't know her dad's center was housing COVID patients at the time he was infected. The facility does not have a history of deficiencies, but having recently lost him to the virus, she knows the importance of getting it right and the pain of saying goodbye.
This is something that you really need your brightest and your best on.
The state also tells us they are in daily communication with all of these facilities. Katie LaGrone, Fox 4, in your corner.